Okay, I'm Dr. Bramlett, Kenneth Bramlett. We're in Birmingham, Alabama, and we're going to talk about plantar fasciitis, which is a very, very common problem affecting about 3% of the population. It's hard to treat. People suffer from it, and their common symptoms are when they walk, particularly when they first get up in the morning, or if they sit down at lunch or from a truck ride and get up and they put the foot down, it hurts like a lot. They complain about it. They change their shoes multiple times. The options to treatment are very simple. One, you can wear better shoes, which with a good arch support. Two, it's common to have an injection in the heel, which nobody really cares about that a lot, but it does work temporarily most of the time. You can take an anti-inflammatory such as Advil Aleve, which is very common to take over the counter. You can take things stronger than that, Celebrex, Lodine, which are medications that are prescribed. If it continues to be a problem, the exercises you can use are massaging with a golf ball, stand on the side of a step and stretch your heels. Riding a stationary bicycle can be beneficial, but bottom line is good shoe support and commonly associated with weight loss, as well as good exercise on a routine basis. Stretching your calcaneus and your heel cord is very helpful. So let me show you. This is a drawing. So this is basically plantar fasciitis of the foot, okay? So this is the tibia, toes, this is a heel of a foot. What happens is a spur from chronic wear will grow on the calcaneus. It's from wear and tear, because what happens is the plantar fascia is this tight tendinous sling underneath the foot. And when you put pressure coming down on walking, this gets stretched hard and it pulls and it makes small micro tears. So what happens is that gets very painful. It's like stepping on a rock. So a good example, which I'll show you, of the bone is this. The rubber band is representing the plantar fascia, which is the sling underneath the foot to hold it steady, okay? And the spur is what I've shown here with a little piece of putty. So when you pull on it, it pulls the plantar fascia off the heel and it makes these small spurs. So the surgery is to pull this down and take the putty off. So that comes away. So the plantar fascia remains in this fashion. So it springs and allows the foot, when you walk, to hold pressure. So that's really what you're doing. If you look at it graphically, what you're doing is taking this spur off so that it doesn't exist anymore. So now you've got a nice smooth contour under the heel, okay? And the plantar fascia now is going, attaching to the back of the heel, and no longer do you have this hard spot that you're pressing on. That's why it hurts so bad. So that's how you treat plantar fasciitis. So we're showing this education video. Hope it's helpful to you. If there's any question, please let us know. We're glad to take care of it if you need to.